Hemispatial neglect, also known as unilateral neglect or hemi-neglect, is a neurological condition in which a person is unaware of or neglects one side of their body or one side of their visual world. These individuals might eat food from only one side of their plate, groom only one side of their body, or apply makeup on only half of their face. This condition typically occurs after a stroke, and although it can occur following a stroke in either of the brain hemispheres, the incidence is higher and the symptoms and their persistence are more severe following a right hemispheric stroke. Because of this, and the fact that the right hemisphere is responsible for the left side of the body and perception, the side affected by the damage is usually the left. So in this video, the neglected side will be referred to as the left side, but note that this is mostly for simplicity, and that right neglect is possible as well. There are several subtypes of hemispatial neglect. Personal neglect involves neglecting the left side of the body, often leading to difficulties with self-care tasks like dressing or grooming. Peripersonal and extrapersonal neglect refers to neglect of objects or people on the left side of the environment, making activities like reading, eating, or crossing the street challenging. Furthermore, it's possible to distinguish between egocentric and allocentric neglect. With egocentric neglect, you're unaware of things in the left part of your visual field as a whole. And with allocentric neglect, you're unaware of the left side of individual objects, no matter where in the visual field they're present. These symptoms are sometimes accompanied by something called motor neglect, where the affected person will not make use of limbs that are located on the neglected side of the body. It's important to note that even though some of these symptoms may sound similar to being half blind, hemispatial neglect is not a sensory deficit, but a disorder of attention. Because of this, even mental imagery can be affected. This is called representational neglect, and this kind of neglect will display itself if you ask an affected person to describe a place from memory. They will then, you guessed it, only describe whatever would be to the right of their point of view in the memory. Furthermore, people with hemispatial neglect are usually completely unaware of their condition. So, while a one-eyed person could just turn around to see what they're missing on their blind side, a person with hemispatial neglect wouldn't even know that they're missing anything, and so they wouldn't think of redirecting themselves. When it comes to the assessment of neglect, there are a couple of simple tests that are commonly used in clinical settings, and here follows a description of 4 of the most common ones. In the object copying test, the person is asked to copy a drawing. If neglect is present, the copied drawing might contain only half of the image or half of the individual components of the image. In the clock drawing test, the person is asked to draw a clock. With neglect, the clock is commonly drawn with only half of the numbers present, or with all numbers squeezed into one half of the circle. In the line bisection test, the person is asked to mark the midpoint of a horizontal line. If neglect is present, the person will perceive only part of the line, and so they will mark the midpoint as closer to the edge than it actually is. In the cancellation test, the person is presented with a sheet of paper containing a random array of evenly distributed items, such as letters, numbers, or symbols. The task is to mark, cross out, or circle specific target items, for example, all occurrences of the letter A. When performing the cancellation test, a person with hemispatial neglect might only cancel items on the right side of the paper. These tests, however, are rather crude and also do not tell the clinicians much about how the condition affects the person in real life. Furthermore, they all require the person to have intact vision and visuomotor control, which is not always the case after a stroke. So, for a more nuanced and life-based assessment, the Katrin-Berg-Gago scale is used. The Katrin-Berg-Gago scale consists of a series of everyday life tasks designed to assess a person's awareness and exploration of the left side of space. Here, the tasks are carried out by the person being assessed, and the clinician then grades each performance on a scale of 0 to 3, 0 being no neglect and 3 being severe neglect. After assessment, treatment can ensue, and one of the most effective treatments to date is known as prism adaptation therapy. During this therapy, the person affected by neglect wears prism goggles that shift their visual field approximately 10 degrees to the right and are instructed to point at a target situated in the center of their actual environment. Due to the shift in perspective, the person will initially point too far to the right, but after repeated tries, they will adapt to the visual shift and be able to point straight to the target without mistake. Afterwards, when the goggles are removed, this adaptation will linger, and now, when the person tries to point straight ahead, they will actually overshoot and point slightly to the left. This so-called after effect is not permanent, but in people with neglect, this way of tricking the brain to acknowledge the left part of space affects brain functions that are disrupted. And because of this, many neglect symptoms can be substantially ameliorated. Other treatment options include visual scanning training, where the person is taught to consciously explore and pay attention to the left side of space, and transcranial magnetic stimulation of the brain, where the uneven activities of the hemispheres are temporarily made less severe. In the future, assessment and treatment of neglect might involve gadgets like VR glasses equipped with eye tracking technology, as this would allow for a much more detailed assessment and a much more flexible treatment. For example, with the eye tracking technology, not only the person's field of view, but also their distribution of gaze and response time could be recorded in a highly accurate manner. And with the VR environment, assessment tests could be carried out also in situations which would otherwise be inaccessible or dangerous, like shopping in the supermarket or crossing a busy road. It would also be possible to create customized therapeutic VR games, in which new targets could be continually spawned at the precise border of the person's attentional capacity, pushing the limits further and further with every session. It's important to note, though, that this is all still in the phase of research. Thank you for watching this video about hemispatial neglect. My name is Elliot from Heikele, and I'm a student of Clinical Neuropsychology at the University of Groningen.